Good afternoon, everyone. Thanks for being here. This is the April 15th, the weekly update from City Hall. Have a list of odds and ends first, and then I'll get into talking about the coronavirus and the mitigation. First of all, we conducted a brief traffic study, narrow scope traffic study to main arteries and collector streets in Rapid City over the last week. We found that the traffic on these streets is down 25 to 30% typically. So this is a good sign that people are staying home, cutting out the recreational travel at least. So this is about what we were hoping for and what we were expecting. On another item, there needs to be some clarification on the landfill issue. We put out a news release a while back about the landfill and the yard sites, and that has become nearly as controversial as the coronavirus. A lot of angry people. This weekend is supposed to be fairly decent weather, so there'll be yard work. So there's lots of inquiries about this. So just as a matter of fact, the remote yard waste sites are not being opened yet due to the employee shortage. The shortage is caused primarily, if not exclusively, by the volume of privately hauled loads of trash into the landfill. It has doubled at least over the last 3 weeks. And that has all hands on deck within the landfill borders. And that means we cannot budget the employee time to make round trips to all of the remote yard waste sites at this point. So there is a bit of self-protection going on here with the city work site, and we're doing the same with our other essential services. Our primary goal with solid waste, the solid waste division, is to continue, no matter what, to perform curbside pickup and to allow commercial haulers to bring in trash as our primary goal. No one wants that to be suspended because of illness or anything else. So we are being very protective of these workers. But the primary reason, if not the only reason, for the lack of yard waste sites is the employee time necessary to do that, and those employees are busy. The other item was how much garbage can you bring in for a city garbage bill? In other words, a free load if you're a city garbage customer. And that answer is 1,000 pounds. The original policy was it are carefully articulated cars and pickup trucks up to 1,000 pounds. So there was some confusion when some folks bringing trailers in, and we've got that all cleared up now. So whether it's a trailer, a car, a pickup, or a donkey, you bring in 1,000 pounds and have a valid garbage bill in the last 12 months, you get in for free. Over 1,000 pounds is going to require being weighed, and there will be an additional fee for that. Changing topics, the outflows from Pactola Reservoir have had to be increased due to the moisture. That's caused Rapid Creek to rise, which has then in turn caused partial blockages of bike paths. So right now, today, we have bike paths blocked at the Canyon Lake Drive crossing and also the Mount Rushmore Road crossing. So those will be barricaded. Soon, I would imagine, the 5th Street crossing and some others. That also builds a little tension because we're trying to encourage people to use the paths, but then there's a high water issue on the path. It's not going to be resolved anytime soon. Changing topics, there are, as of today, as strong as ever applications for building and land use permits. So that is one industry that is going strong. That's good for everyone. Now, on to coronavirus. Last week, 1 week ago, I held a press conference in here with an update. So it has been 1 week, and in that week, South Dakota has logged in 721 new cases of coronavirus for a total today of 1,168, a substantial increase over a week. In other words, 161% increase. Now granted, nearly all of them are in Minnehaha and Lincoln County. And we all know about the Smithfield pork producing plant, and we can find that on the news and watch or read about that. So this is a substantial increase. Now, I just heard on my way down here that Sioux Falls has now become the #1 fastest growing hot spot in America. So as far as Pennington County goes in western South Dakota, this slow start was not predicted. The start across the state was fairly consistent, and so we were not expecting that in the middle of April we would be standing here saying we are still logging in 9 cases. There is a great amount of anxiety over those 9 cases. How can that be accurate? That's only because we're not testing people. There are all kinds of comments about this, and people calling and writing with their concern that there's something not being done properly here. So what we do then, understanding of course that there are a number of healthcare providers around the city and around the region that are administering tests and sending them to laboratories, either private laboratories or the state health lab. And we don't have those numbers, those submissions. But we go back to our major hospital system, Monument Health, and we learn that the low numbers reported by the state are consistent with what these caregivers are seeing in the hospital system. Relatively low rates of respiratory issues, and there doesn't seem to be anything out of whack there in terms of hospitalizations or who they're seeing for what symptoms. So I conclude that our low number right now is fairly accurate, although it was suggested a week or two ago that because of the global shortage of testing supplies, we would be fairly accurate by taking the number of documented cases and multiplying times 5. Now, I don't know if that's still the case because Minnehaha County is getting a lot of attention out there. There's a lot of tests being done, of course. So I really don't know if that's an accurate way to gauge it or not. But it is likely that there's someone who has coronavirus that has not been tested. So I brought this poster board back. I showed this some time ago, a couple weeks ago probably. And this is a basic articulation of the curve, and we talk about flattening the curve. And so what we see here is the healthcare system capacity in the dotted line. And what we see in the red line is the arc identifying the spread and the rate of the spread of coronavirus in our communities across the state. And early on, that arc exceeds the healthcare system capacity in the state. Unmitigated, there is no way to control the rate of spread, and it will far exceed this capacity. So the mitigation efforts that we have put in place in Rapid City and for the most part across the state have caused that arc to be flattened. And this is according to the professionals who have done the modeling that's now being used by all the major hospital systems in the state, as well as the state of South Dakota. And so we see in the blue solid mass here, that is the new arc with the current protective measures in place. So this is the goal. The goal, the only goal at this point, in terms of government action, in terms of social distancing, staying home, wearing masks, all of that goes to one singular goal, and that is to keep the arc of the disease spread below the hospital system capacity. So this happens by spreading the spread of the disease, pushing the spread of the disease out over the longest period of time possible. So it's still going to have an arc, but that arc is not going to be here in early April. If it would have been unmitigated, it's going to be now, as projected, sometime in June. But the more we do in terms of mitigation, the smaller this blue mass gets, the smaller the arc is, the longer it gets, and that means we stay healthier. So, I have some common arguments from the citizens on this. In fact, there is, well, let me just finish saying, if we lay off our mitigation efforts and the arc, the amount of cases in the shortest period of time exceeds the hospital capacity, people will die. Not only from coronavirus, but they'll die of other things that they're in the hospital for now. The cardiac patients and the kidney disease patients and everyone who's got a serious reason to be hospitalized or need intensive care, they will be competing for beds with coronavirus patients. There's not enough for everyone. I'll get into some numbers in a minute. So the consequence of not engaging in the mitigation of this disease are grave. No doubt about it. You can hear that from all the national experts, the state experts, the locals. You can hear this everywhere. And the blessing of having a slow start on the uptick of this disease in our community is we have the privilege of watching other communities deal with this, to learn what works and what doesn't work, and also to allow the experts here to become more educated, more experienced with this particular strain of virus. So this is working. It's working, but it's not done working. It needs to continue to work throughout the bulk of the duration of this. So social distancing is very important, and I just included one of our posters over here to indicate the type of messaging we're putting out, and it's very basic stuff. Positive shopping practices. If you need to go out, use these steps. This is very basic stuff, but there are folks who really need reminding that this is important. Okay, so now recently there is a rising dialogue of herd immunity. So herd immunity is something that the infectious disease doctors will refer to, but now we have lay people referring to it and also offering their advice on how to get it. So the herd immunity conversation is coming up in the context of the faster we become infected, the faster we will all be immune. So what we need to do, this is the advice of citizens, not me. They are saying what we need to do is ignore this, go about our lives, get infected on the arc that here is pictured in red. Therefore, when it's over, the majority of us will be immune. That's the fastest way. Well, that's true. That's absolutely true. That's the fastest way to get on the other side of this. However, it's also the most deadly way. And the same people will say, the majority of us won't even suffer consequences from this. We'll have very minimal symptoms. Right, but I want to talk about those numbers for a minute. Because of the mathematical predictive modeling that's in place in the early stages of this disease, there has been a wide prediction, a broad prediction of how many South Dakotans may get infected. It has been stated between 30 and 60% was the original statement. Now that's turned into 70%. So we have some organizations reporting that it could be 60 or 70%. And so I'm just going to give you some numbers based on the lower end of that. Let's say only 30%, the lowest predictable estimation of the infection in our state. 30% of us are going to get infected. Now, in western South Dakota, we have one major hospital system here. Multiple hospitals, one system, Monument Health. They serve an area of 450,000 people. So when we need medical care, we're not sharing it with 77,000 people who live in Rapid City. We're sharing that capacity with 450,000 people that get direct service by Monument Health. So 30% of 450,000 people is 135,000 infected. 135,000 infected. Now, following the early estimations were that upwards of 20% could need to be hospitalized from this. And it's still early, so I don't think anybody can know for sure, but following what's happening in Sioux Falls, we see about a 4.3% of their infected are requiring hospitalization. So 4.3% of 135,000 is 5,800. That's more hospital beds than we have in all of western South Dakota. That's a normal capacity. It's near the normal capacity of the entire state. And this is just in western South Dakota, just our 450,000. We need 5,800 hospital beds. Of those 5,800, approximately 5% will require intensive care. And intensive care could and very well could mean needing a ventilator. 5% of 5,800 is 290. That exceeds the ability of our hospital system to provide intensive care under normal circumstances. So, back to the red line. This is why going out and holding a quasi-chickenpox party in order to get infected as fast as we can is a bad idea, because it will overwhelm the hospital systems and it will cause a portion of these 5%, if not the majority of the 5%, to die. It'll also reduce your ability to get treated for serious illness or accident, injuries from an accident. So this is why it's important. Doing that, preaching herd immunity, get it fast and get it over with, because only a small percentage will die, is a very, very reckless position to take on this. And you shouldn't take this type of advice from the guy down the street who has an opinion about it, but that's who's controlling the narrative. Recklessly causing a spike in infections will be deadly. And this might be the most ignorant and dangerous statement that we have heard to date. So, this is still the goal. This will remain the goal. And weeks from now, whenever the peak comes, and no matter what level the peak is for western South Dakota, this always has to be the goal. Okay. We just heard, I think it was out in the news already, but the Federal Aviation Administration, the FAA, has made a ruling, or has an opinion, that airport staff at our airport may not screen passengers coming or going. That's been a big question for people. Why are we letting these foreign people from other states into South Dakota? Because our hands are tied, that's why. The airport is largely an FAA-funded organization. They make all the rules. We comply with them. It's not like it's the mayor's airport and I can go out there and do whatever I want. Moving on to parks. We have now 11 porta pots out in our public parks. We have closed the public restrooms. This may seem cruel or controversial. However, there are less things to touch in that porta pot. There's less chance for spreading infection in there, as opposed to the bathroom with the sink and the stalls and folks along the central part of the city taking baths in those bathrooms or sleeping in them. So this is just the way it's going to be for a while. It may seem controversial or inhumane, but this is more for the public health, and this is just the way it's going to be for a while. From a coronavirus perspective, it's far more sanitary to have a porta pot out there. Now, a temporary, we don't have a name for it yet, so this is long, a temporary emergency homeless isolation center is being planned and could start up at the Rushmore Plaza Civic Center in the Rushmore Hall. This planning is the result of emergency management, the National Guard, various other individuals and organizations looking for a place to safely isolate sick, homeless individuals. However, it's not just sick, homeless individuals, it's sick, homeless individuals who also need supervision. And I've mentioned it here before, it's not entirely comfortable to talk about or to hear, but not everyone who's homeless can manage their own affairs. Many of the homeless we see walking around on the street will have an addiction problem or some other personal health issue that may prevent them from taking care of themselves. So if and when they become sick, they cannot be told to self-isolate, especially when there's not a bed to do so. So we'll be setting up beds. It's in the virtual stage right now, but we'll be setting up beds in order to provide an isolation space for the homeless. We've been criticized on this already. Why don't we put them in hotels? Why don't we spend money on them and put them up in a nice place? Well, that's being done to a large extent. The Volunteers of America and also the Homeless Coalition are providing motel and hotel rooms for homeless families. And they have to be screened because these are families that have the ability to self-regulate as far as their behavior. So that is happening. And it's the select few that will not comply or not likely to comply with direction without supervision. Okay? This is a long one today. I want to address the apparent, quote unquote, the apparent conflict that we have with the governor. There's a lot of comments on it, especially after my appearance on CNN yesterday. I think everyone wants us to be in a fight. So the governor has her decision-making process. And as we have seen, she is not wavering on this issue. Well, city mayors and city councils also have their decision-making processes. And because the tactics and strategies and goals are not unified from one end of the state to the other, we're seeing that the practices and the approaches are somewhat different. People assume that this is a fight between the governor. I did interview yesterday with CNN. I got two types of comments. Good job, very diplomatic, and why did you trash the governor? And I do not believe I trashed the governor. Sticking up for Rapid City can't be the same as insulting someone somewhere else. So, but as I said, I think people want this to be a fight. It's not a fight. However, the conversations have been public rather than private. As we know in South Dakota, especially western South Dakota, but South Dakota generally, we do things independently. We don't get together a big group and plan out in a very sterile environment. What we do is we see the problem, start researching it, find a solution, and look to implement it. So since these conversations have been in public via news conference or social media posts, it makes a good environment, or creates the environment where it looks like we're bickering. And this should be of no surprise to anyone that this is going on, because neither the governor nor I are yes men. We are not someone who nods and follows the pack. we are someone who tend to lead the pack. And so because we have a different idea, just means we have a different idea. We attack problems in our unique fashion. So yesterday, the mayor was on CNN with Anderson Cooper. He asked questions and I answered them. Again, a variety of interpretations of that whole conversation. But one of the main questions I got asked was, why would you go on CNN? Why would you go on this fake news CNN? Well, because they asked. And since I was in my last career as a law enforcement officer, since the time I had gotten into the command structure and started doing interviews with the media, I have never refused an interview. Never had occasion to. I did give an interview once where, in hindsight, I wish I would have refused it, but that was because of my own dumb behavior during the interview. I didn't say the right things, and I caused a problem for myself and others. But I just don't refuse interviews. So it's because they asked. That's why. I didn't go to CNN and beg for airtime. They asked, and I said yes. And we've gotten inquiries from other national media outlets as well, and it's because there is great interest in South Dakota's rising count of positive COVID-19 cases. And there is also great interest in the piecemeal approach to mitigation that we have in South Dakota. That's just the way it is. People are looking for a controversy, and they're bound to find one. So, to that extent, I just want to read a one-sentence email that I got today. This is from a citizen to me. You were wrong to criticize the governor on CNN. We are not sheep that need your protection. We are adults who can make our own decisions. Don't be a useful idiot for the left. And that, my friends, is the problem here, is that we have concluded this pandemic is appropriate to put in a partisan boxing ring in order to argue it along party lines. And that is just not helpful. In fact, it's probably the dumbest thing that's going on right now in our nation, is that we're trying to make this virus a Republican virus or a Democratic virus, and that is not helpful. So it's not true also that people don't need protection. I mean, this individual that wrote this was angry, but if he were accurate in his assessment, then we could fire the entire police force and the fire department and the paramedics. We don't need protection, is what this guy's saying. It's absolutely false, and everyone knows it. There's a responsibility of governments to protect its citizens, and that's what we believe we're trying to do at this moment. We also think the landscape on this is going to change over time. We're going to have to make adjustments, and still it's moving so quickly I won't be able to predict what's going to happen in a week from now, let alone a month. But that's why we're here working on it every day to get the best information out possible. So if any of you in the room have questions, that'd be great. I think the audience would appreciate if you went over to the microphone so they could hear your question. Go ahead.
Thank you, Mayor. Nathan Thompson with the Rapid City Journal. You just said we can't predict what's going to be going on next week. However, on Monday, the City Council will again be taking up that emergency ordinance. What is your feeling right now, your recommendation? I know it can change between now and Monday, but are we looking at an extension? Are we looking at additional things maybe being passed via resolution on Monday?
That's a great question. I think I'm really not able to predict with certainty what will happen, but my own assessment of this is that it is not time to lift the restrictions in their entirety and go back to the way we were. And that's become a popular argument. We don't even have a problem in West River, someone says. Open us up and wait till we have a big problem. Well, that's how it's been handled at Smithfield in Sioux Falls. There's a big problem, so now there's a response to it. There is some risk-taking and guess-making in this whole thing. My prediction is that there will be an extension of this. For how long, I wouldn't venture a guess, but we all understand that this measure is temporary. We just don't know how long temporary is at this moment.
Lee Strubinger, SCPB. You talked a little bit about clinical testing across the city and how it's tough to get that information. I guess could you talk a little bit more about what information the city does have and the amount of testing that's being done currently, and maybe even the number of negative tests, I think would tell people.
Yeah, I wish. That's a great question. I wish we had access to all of that, because I think that would serve to calm this community a little bit. We cannot get the information that tells us how many people from our community have been tested and how many were negative. We can only find out if there are any that are positive. So the Department of Health doesn't have that information to share. There is some effort in the healthcare systems to coordinate those and get to that number so that we can all understand what it is, but we just don't have it today. So there's a lack of information, and in a situation laced with some panic, I think that type of information would be helpful.
Mayor Dave Kidd, News Center 1. With the lack of revenue coming into the city, or not lack of revenue, the decrease in revenue coming into the city right now, have there been any thoughts on how the city is going to approach the budget for the rest of the year?
Oh, absolutely. Another logical question. This is a financial drain. People assume that since we're in government, we got all the money in the world, and there's no threat to that government. A few years ago, when I gave the budget address to the city council, I said, here's a potential problem. 44% of our general fund revenue comes from sales tax. That's a big piece of the pie coming in from one source, dependent largely on tourism. Not entirely, but a significant portion of it on tourism. And so my suggestion was, I had a suggestion without a solution because it is complicated. We have to find a way to diversify our revenue streams in case one of them comes under attack for some reason. We can then find out, we can realize less damage from that. So 44% from sales tax, 27% from property tax. So we're now in the process of forecasting and preparing a resubmission of the 2020 budget. We're expecting upwards of 10% reduction in property tax due to people not paying bills or extending them into the next year. And we're also looking at a significant reduction in sales tax. And the number we're working with right now, which could change, is we need to take about $7 million out of 2020's budget in order to break even at the end of the year. And so we're looking at all sources for that right now. There's been no definitive decisions. We had one of our significant meetings on that today. I think will be finalized on what the plan is by next week at this time. And then we will submit that to the City Council for them to approve the new budget authority. Once that's done, we need to start planning out the 2021 budget because we also expect reduced revenue that year as well. And not as dramatic as 2020, but still significant. So this will mean things are going to change around City Hall and out in the community, and we're gathering up that information now as fast as we can.
Is there any data that you would like to see that would help you make more informed decisions to lead the city during this time? What kind of information would you like to see maybe from the state?
Well, from the state or someone, I would like to see the testing information, the negative tests, the number of deferrals, and just to just to get a better finger on the pulse of how that's going. Now, I think there must be a way to accomplish that, but the other information I need, I believe, will come from the citizens, and I am developing, I think I'm done today, I'm developing a citizen survey that will really ask citizens about their current situation and the sustainability of that and what the greatest needs are for city services and so on. And then we will base some of our decisions based on that. We have the economic numbers rolling in. They're not pretty. Our unemployment is probably in the 7+% now, coming from 2.9%. That's significant. Unemployment claims are off the charts. And so, but we're also evaluating the federal dollars that will come in for this disaster and others that will help to correct some of those issues. For example, public transportation will be getting some federal money at some point to make up for the losses there. So it won't be a burden on the general fund of the city. But there's a lot of little moving parts that have to be addressed. And you know, one of my big sources of information has kind of been shut down. I make it a point to go to the grocery store and hardware store and hang out in public places, and I pride myself on being approachable, and people come and talk to me and make relationships, and that's really been reduced to a bunch of mostly angry emails at this point. So I am, as the days and weeks go on, I feel like anyone in my position should feel a little bit at risk for becoming detached from the public needs. So for that reason, we'll start polling and start trying to get that information away from community members.
Mayor, you spoke about the independent nature of South Dakotans in this time where we're dealing with outbreaks in Sioux Falls and in other parts of the state. Talk about the collaboration with other mayors. What are you doing? Are you sharing information, sharing ideas? What is that communication like right now in the state of South Dakota?
The communication between mayors is good. We have at least a weekly conference call, and we discuss the issues within our communities. When someone has a project they're working on relative to the virus mitigation or in terms of a city ordinance, we share that information. We use the South Dakota Municipal League as kind of a pivot point for the state, and so they host the conference calls. They're the central repository for the information that we're sharing, and they do a lot of that coordinating for us, so that's very good. In addition, I would say almost every week, the governor is able to join that call so we hear from the state perspective as well. And so all of that's good. We also have open lines of communication with the county, and the county is approaching this a little differently because, frankly, there is a different level of authority to deal with public health issues in the counties as opposed to the state. And you know, on veto day, on the 30th, the South Dakota legislators denied counties the ability to mitigate their own public health crises. And the feeling was that they should just look to the state for that. So we do have decent communication, much, much more than normally, which is good news for us. And I hope when this is all done and we're back to whatever our normal definition of life is, that it will include more cooperation and communication statewide.
Just curious if there's been any update with the 100-bed facility between the state and the South Dakota National Guard?
I've not heard, I personally have not heard more about that National Guard hospital. It's possible that there's someone in the city who has, or emergency management. That unfortunately didn't come up this morning in our meeting. Any others? All right, thank you everyone for being here. I appreciate it.